NORD Summit really is unique. And I think it is, in many respects, the most important, or one of the most important meetings for the rare community each year, because it brings together the entire community. We do have our separate meeting for patients and caregivers, and others have meetings that are more tailored to industry and the process of developing orphan products and commercializing them and that sort of thing. But the summit really tries to bring all those topics together and get people together and say, each of us is coming from our different perspective. We're working on this in different ways, but what are the challenges that we can all talk about together, and how can we work together to address those challenges? So the summit does bring together an audience of certainly many people from patient organizations, many people from government. We have a very strong participation from NIH and FDA, and many people from industry and academia who are working either on the research side or the business side to bring new diagnostics and treatments to patients. Regarding the virtual aspect of it, I think we were all a little disappointed at first when we realized that it was going to need to be virtual again this year to protect the health of our participants. But I think there are some aspects of the virtual program that are really good. And one certainly is that people can participate who wouldn't be able to come to a meeting in Washington, D.C. Last year at our virtual summit, we had participants from, I believe, 19 countries outside of the US and from 46 states. And this included many people, such as parents who are stuck at home with a sick child who wouldn't have been able to travel to a meeting in Washington. So, I think the bright side of the virtual piece is just being able to reach that broad community. It was so interesting last year as we were looking at the questions that were coming in to the speakers via chat as they were speaking. And we had questions coming in from people all around the world. So that aspect of it is good. I think the other piece that we really try to address with the virtual program, we always try to have the strongest possible program. But, even perhaps more so with a virtual one, because we recognize the importance of having speakers who really are working at the cutting edge of the topics they're addressing. And this year's topics, I think, reflect this kind of special time situation that we're in with the pandemic now. So we're looking at things that have become more apparent to us over the past year and a half as a result of the COVID experience. So topics like addressing rare diseases as a public health challenge. I think, we've realized some of the things that we've learned with the response to COVID may be applicable to our response to rare diseases, to try to speed up that process of looking for treatments for these 90% of rare diseases that don't have treatments. We're also looking at topics like the impact of COVID on research. And we'll have speakers. We have the president and CEO of BIO, who's very involved on that topic. We have folks from FDA, people who have written FDA guidances on these various topics related to this. People from academic institutions who have, can talk about the impact on their research. Some of the other topics this year that I think are really exciting and fresh, when we think about, obviously getting a timely diagnosis is one of the biggest problems for people with rare diseases. So we have a session that will be a case study on something that was done in the state of California called Project Baby Bear. And we have a state legislator, Assemblyman Brian Mindshine, who will be speaking along with the chief medical officer from Rady Children's Institute for Genomic Medicine, along with a representative of Blue Shield of California. And they'll be talking about this project through which very, very important genetic testing was made available to infants that actually ended up saving money. So it's, it's a great case study in how to accelerate the diagnosis process and save money in the process. And that's being considered in some other states now too. We also have some sessions that will be looking at the impact of data and data sciences, and how are we using patient data in new and different ways to advance research.